I've got a little bit of information to present to you, a little bit about Canyon View. I know at least Tyler I've seen here as a patient many times. I know Tracy's a patient here because he's also a longtime doctor here. I don't know about the Coopers and Bill or Tanner. I don't care one way or the other. I'm not trying to get into your personal medical information, but if you want to see maybe some more back-end part of a doctor's office that you maybe don't normally see, I'm happy to walk you around. First of all, Enoch Ludlow was the original founding physician of Canyon View. He came in 1957 when he finished his residency. So typically a physician will do obviously their undergraduate degree, then 4 years of medical school, and then some sort of specialty specific training. And for the minimum, it's 3 years to become a family medicine doctor, pediatrician. OBGYN is 4 years. Some can be as many as 9 years for additional training and fellowship and things like that. So Enoch came here back in the 50s. And he was a solo doc, a general practitioner as they were referred to back then. And he did everything, whether it be the primary care or delivering babies, surgery. In addition to that, he was also a real estate developer, landowner, and was also a sheep rancher and ran thousands of sheep up on the mountain. Wow. In fact, one of the funny stories his son told me one time is that one time the church came to him and said, "Brother Ludlow, we see that you own such and such parcel of land. We'd like to build a church and wondering how much you'd be willing to sell it to us for." And he said, "Well, this is my price." And they said, "Well, okay, well, we've got a few other parcels we're also interested in, so we'll get back to you because we didn't really want to pay that much," type thing, right? So they called him up a couple weeks later and said, "Brother Ludlow, turns out you own the other parcels of land we're interested in as well." So Enoch was in practice until the late 80s, is that right, Tracy, when he retired? And then he died in 2015. His house that he lived in up until his death was just right across the street from us here. And so I would look out the window and see him getting wheeled in his wheelchair over to the clinic and then back home by his wife. And he was, continued to be a patient here up until his death, but he was a great man. I only interacted with him once or twice personally, but I've heard lots of great stories about him. Anyway, so he was a solo practitioner until 1974. Then he brought in two partners, Robert Hogan and David Flinders. And both of them also did everything. Dr. Hogan died in 1994, and Dr. Flinders then retired from Canyon View practicing and went over to the Utah Valley Family Medicine Residency Program. And he worked for many, many years helping train family medicine doctors up at Utah Valley Hospital. And then when he concluded his family medicine residency program career, he then went to the county health department and was the county health medical director. And he retired from that just a few years ago here. So for nearly 25 years, it was known as Spanish Fork Clinic. And there are still many patients that come in today and say, "Oh yeah, I go to Spanish Fork Clinic." And we still refer to this as our Spanish Fork office. But in 1997, there was another group over in Springville called Art City Medical. And those two groups merged together to form Canyon View Medical Group as we know it today. And we've had a primary care focus the entire time. So we offer family medicine, where we've got 11 doctors and 16 nurse practitioners or PAs. We've got one sports medicine doc. So he did his primary training in family medicine, but then he did an extra year of schooling with a fellowship in sports medicine. And so he helps out occasionally in our urgent care, but most of his day is spent dealing with people that are dealing with sprained ankles, muscle pains, joint aches, those types of things, broken bones. That's Dr. Cameron. Then we've got 3 OBGYN physicians, all 3 working full-time, which is a big deal for us because for a long time we had 2 doctors kind of part-time job sharing, Dr. Warner and Dr. Ludlow, and they eventually retired, and as we've replaced them, we're now back up to 3 full-time physicians and 3-time nurse practitioners and PAs. So our OBGYN department is finally growing again. We're excited about that, and I'll show you a little bit more detail about that later. Then we've got 4 pediatricians and 1 physician assistant in our pediatrics department. And we have a new pediatrician coming this summer that will expand our group to 5. So we're excited for that. So in total, we have about an equal mix of physicians and nurse practitioners and PAs of nearly 40 providers total. It will be 40 this summer. Our offices go from Springville down to Santaquin. We have family medicine in our Springville and Mapleton offices. Then here in Spanish Fork, we have all 4 of our specialties, although they're in 3 different buildings. So the building you're sitting in today is our family medicine office. Next door, where the original building was, is our pediatrics department. Then our OBGYNs are over at Spanish Fork Hospital, and then our sports medicine doctor is also here in the family medicine building. Before Spanish Fork Hospital was built, they officed here and would drive up to Utah Valley every time a patient needed to be delivered. But when Spanish Fork Hospital opened, then they moved over to be directly attached to the hospital.
Deliver at Payson too?
Yeah, and so we've always had a presence at Payson, and always had an office right next door to Payson Hospital. Then we've got in Salem is our newest office. We have a Salem family medicine office, and then Payson, as I mentioned, we have the OBGYNs, and then in Santaquin we have family medicine and pediatrics. I'll just pull up here our locations and you can see our buildings. We have a new building coming in Springville. I'll show you this a little bit more about it. Our Mapleton building is right on the highway in Mapleton. And then this building here next door is the original pediatrics building, Spanish Fork Hospital. Our Salem building is right above Salem Total Fitness, now 180 Fitness, in that strip mall section there. Then Mountain View Hospital is where our OBGYNs are, and then our Santaquin office right on Main Street, just west of Center Street. So most of them are working primarily out of only one office.
Okay.
And as soon as I say most, except for all of our Springville and Mapleton providers, they bounce back and forth between the 2 buildings, especially right now while the Springville building is under construction. We've had to limit the number of patients that can be seen at Springville because we just don't have enough parking anymore. And then they're mostly being seen over at Mapleton, but still rotating through. The Spanish Fork doctors are pretty much exclusively here. Our OBGYNs bounce back and forth between the Spanish Fork and Payson buildings. And then our Santaquin docs stay in Santaquin, with the exception of our urgent care. They come up and help here on Saturdays. We have our urgent care open in Springville and Spanish Fork on Saturdays. And so the Santaquin docs help out in Spanish Fork, as well as the Salem docs, and then the Springville and Mapleton docs cover the Springville urgent care. And then we also have the one pediatrician in Santaquin, and she also comes up to our pediatric urgent care and helps out there as well. So right here, this is our current building. This is Springville Main Street, and this is 400 North. Okay, so our current building is going to be torn down and turned into the parking lot when the new building goes in here. So this is the new building. It'll be 2 stories. We'll have family medicine all on the first floor. The second floor will have space to expand and rent to additional providers that come in, or for us to grow, as well as the break room, administrative offices, and things like that will be up on the second story. It will be a similar red brick to what Springville is kind of known for with its facade and things like that. But we're really excited. That building will be done hopefully in August. If you were drive by today, you'll see it's got the full steel skeleton, and we're framing inside of it now. This has been something that we've been wanting for probably a decade or more. We've been in the planning phases for it, between us just strategically planning as well as jumping through hoops with the city and things like that, getting it going. It's exciting to happen. This building was originally a house, which was then further expanded and made into a grocery store, which was made into a bank, which was made into, it's been all kinds of things. It's like over 100 years old, the building we're in. It's got multiple different roof lines. We currently have had so many problems with roof leaking. We only use about 6 exam rooms in the building currently, because we've limited the number of providers there. And so we've literally had water dripping through the ceilings this winter. We just said, all right, that exam room's closed. It's never going to be used again. We're not going to bother trying to repair this any further. It's just become a nightmare trying to keep up with it. We've put lipstick on that pig enough. Now we're going to build a brand new building. Some things that we offer besides our specialties, we have various ancillary services. So we have what's called a moderately complex lab, meaning we can do a lot of labs here on site. A lot of doctors' offices, they just have point of care testing that they can just do a quick little finger stick type thing. But we actually have phlebotomists that will draw your blood and process the labs here on site. We have these interfaced with a LabCorp, which is our national reference lab, and we're able to get those results directly into our EHR, electronic health record. We offer digital x-ray at all of our sites. We have a DEXA scanner here. This picture here is the results of our body composition analysis. This is some new software we added to our DEXA scan where it can look at your body, and it's a little bit hard to tell on the screen here, but the white is the bones, the blue is lean muscle, and the red is fat. So you can see in a person how much muscle mass to fat mass they have. So there may be some people that are just stocky build. You know, when you look at their BMI, their height ratio to their weight ratio, it looks like they're terribly overweight or obese. But they work out all day long and they are just solid as can be. And you think, why am I unhealthy when I'm very muscular? Or somebody's really trying to get healthy and they're saying, I'm not seeing any changes in my weight. Well, you're converting your fat into muscle mass, and this helps you see it turn from red to blue. Yeah. And you won't see changes in your waist measurements or things like that. This has been a really cool game changer for patients to come in and see the progress that they're making in their wellness journey. This is me. This is right out of my chart.
Good job.
Pretty proud of that. Yep. It doesn't show, on my screen I see the red a lot more. The projector doesn't show the red as well here. There's definitely still plenty of fat to shave off, but this was after I had shaved off about 20 pounds. So, yeah. So it was a very motivating tool to help you keep track and go, regardless of what the scale is saying or the measurements are saying, this can show you everything. And the other thing that's really cool about it, from not a cosmetic perspective, but one of the things that we look at is visceral adipose tissue, like fat around your heart and your lungs and things like that. That's bad. And you won't see that in my body shape, but you'll see that clinically and go how bad that affects you, and it will show you in the calculations. So then other things that we've got ultrasound at all of our offices, EKGs, that's the thing where they hook up a bunch of leads to your chest and be able to measure your heart rates and things like that. A Holter monitor is something you take home, and it's basically like an EKG that you wear overnight. Ambulatory blood pressure monitor, again, you wear that overnight to keep track of your blood pressure for multiple days. Sleep studies, you don't have to go to a sleep lab. We can, again, just do these in the comfort of your own bed at home. Fundus photography is where they're looking at the back of your eye for diabetics especially. And then the pediatric vision screeners, when you've got little kids and saying, can you read this line? No, they can't even read yet. But that way we can tell if they're struggling with their eyesight when they're just young. Canyon View is owned and governed by the physicians. We feel very strongly that it is a physician-run organization. Most physicians around the country are employed by large hospital systems such as Intermountain Health or HCA or the University of Utah. There's very few independent practices left, and even independent practices, there's very, very, very few solo doc practices. Most of them are in groups, but we have continued to be an independent group for all these years. So the docs own the business and run the business, but they went to medical school and they say, Aaron, we don't want to have to worry about all the day-to-day decisions, so will you and your team take care of that? So me and my team, we take care of the operations, compliance, best practices, following up on the decisions that are made in meetings, hiring and training staff, and those types of things. Here's a little bit about the demographics of the patients that we treat. So you can see by the specialty or by the clinic as a whole here. The communities down here, ages and genders. You can see the majority of our patients are adult patients, but we do have quite a bit of younger kids as well. And it's a pretty even spread. If you were to look at the population of the communities, we treat a proportionate amount of all of them. Here's a little bit about the growth that we're expecting. So this data was put together by Intermountain Healthcare years ago as they were in the planning phases for the Spanish Fork Hospital. But you'll see we are this green dotted line, and we're of course much smaller than Provo Orem was back in 2010. But the thing to see on this is that by 2030, we anticipate that South Utah County will be just as big as Provo Orem was, and will eventually get to the point that it exceeds. And it's pretty easy to think through it just geographically. Provo-Orem, you got Utah Lake that takes up the west side, whereas we've got West Mountain and Santaquin Goshen going all the way out to the mountains on the other side. So we've got more land mass available down here. So we anticipate eventually we will have more patients or more people living around us than any other section of the county. And so when people ask us, are you guys expanding? Are you growing? Are you going to other communities? Are you going to go to Vineyard, up to Saratoga, all that? Like, we got more than enough growth going on down here in South Utah County. We can triple the size of our employees and providers and still stay in the same service area just because there's more homes and more families coming in here.
The right location for the future growth.
Yeah, it'll be a long time before South Utah County is built out.
By 2050.
That's what the projections are showing. Wow. Yep, if you can imagine that far. A little bit about the largest portion of our growth in Utah. About 70% of Utah's growth is natural increase, meaning people just having babies and their own kids staying around, right? So when Intermountain was planning for growth and looking at it, and as we're growing providers, Mountain View Hospital currently has about 500 deliveries per year, and the Intermountain system has about 1,800 deliveries of patients that live in South Utah County. Now, actual deliveries at Spanish Fork Hospital, I don't know what they're at today. I think they're approaching 1,000, but those that still deliver up at Utah Valley, or their doctor delivers at Orem Community, or even some that they had their first baby at American Fork, but then they wanted more house and couldn't afford living next to the tech hub in Lehigh, so they moved down here, but they still love their doctor, so they still go up to American Fork. So if you add up all of the different Intermountain facilities and add those together, we've got about altogether between Mountain View and the Intermountain facilities, about 2,300 babies being born each year in our service area. Now, when you look at that, that's enough to fill a physician's practice about every other year, just with babies being born, not to mention new move-ins, and not to mention trying to outcompete the competition and steal patients from others type thing. So we know we've got plenty of room to grow, and this number will continue to get larger and larger as our population grows. There are some benchmark data that we use to try and estimate how many providers we need per population. The estimate is about 4,000 people per family medicine provider, which is our most common specialty. So if you look at it and go, we've got lots of people being born, lots of need to add a new physician almost every year, just with natural increased growth. Here's a little bit about what we did last year in 2024. So I just pulled this data just yesterday. We had about 150,000 patient visits.
Is that just apart from my visits?
Yeah. Tyler's family accounts for about 1,000 of these. He's a frequent flyer in our urgent care.
That's right.
Proud of it. We had about 582, so nearly 600 babies that our group delivered. About 500 people came in with some sort of cut that they needed stitched up. 250 fractures that we took care of. 7,200 x-rays. 10,000 well child exams. 15,000 adult physicals and Medicare wellness exams. And then 16,000 immunizations. Some of those are COVID, although COVID has gone down. We're not doing many COVID immunizations anymore these days. It still exists, and we have it available for those people that want it, but most of these are childhood immunizations, adult shingles, pneumonia, the annual flu shot, those types of things. Here's our growth over the past 20 years. You can see we're up to 250,000. This is the COVID spike. When many practices during COVID took a huge dip, we went up because we were doing COVID testing out the wazoo, and COVID immunizations, that's 2021 is when we were doing a lot of the immunizations, and we just had lines of people coming through getting their COVID immunizations. And things kind of went down as COVID kind of came under control, and 23 was a down year for us, but then 24, we're back up again in 2024. Over the 20 years, it's been an average growth of about 2% per year. So as I told you a little bit about the history, so David Ludlow, the son of Enoch Ludlow, came and joined the practice, and he was a solo OBGYN for years. Then back in 2008-9, I can't remember exactly when, Larry Warner was a different solo OBGYN down in Payson. He joined up with Dr. Ludlow. And so they had their record year together back in 2009 with deliveries. Then they decided to start cutting back as they were approaching retirement and start job sharing. And they hired a new physician, and volumes just kind of started going down a little bit. Some of that was natural changes in birth rates in Utah. Even though we definitely have the highest birth rate in the country, it's getting lower and lower in our birth rate. And additional providers coming into the area. Dr. Warner retired, Dr. Ludlow retired. We had one of our other physicians that left and took a job down in Nephi, and so then our lowest point as far as deliveries was about 350 patients back in 2018, but then we hired 3 new physicians that have done really well, and now we're up to nearly 600, and I wouldn't be surprised if this year if we're back upwards of 700 deliveries with our newest OBGYN, Dr. Crandall, that just joined us. He's really, really great. I like him a lot. So this is a little bit about our payer mix, as we refer to it, the various insurance companies. So about 17% of our patients are on Medicare, 6% on Medicaid, 1% TRICARE, so this is the military insurance. Obviously, if you're up north in Davis County, it'd be a lot higher with Hill Air Force Base there. One of our physicians is the physician for the Veterans Home, the Benyon Veterans Home in Payson. Dr. Bott is the medical director down there. About a fourth of our patients are on Select Health. 13% are Regents, Blue Cross Blue Shield. Aetna is about 5%. PHP is the public employees. 4%. DMBA is the church and BYU. 4%. Cigna is another large national insurer. They're 9%. EMI used to be Educators Mutual Insurance, and it was just teachers. Now, actually, Nebo School District is on Select Health, and EMI, about half of their business is teachers, and the other half is just any other business out there. They kind of expanded their business line, I think in part because teachers were not always choosing EMI anymore and looking for others. And so we offer our employees Select Health. Nebo School District is on Select Health. There's several other big employers in the area that are with Select Health. Okay, so a little bit about our employees. So we have 250 employees. About 65% of them are full-time, 35% are part-time. You can see the different roles that they work in. The majority of our employees, about a third of them, are medical assistants. Then we have about 50 front office staff, the receptionists and schedulers and things. As I mentioned, about 40 providers. There's 19 people that work in our lab, 15 x-ray techs, 14 people that work in our billing office, and the numbers just keep getting smaller as I go down further. I didn't want to go all the way down, but that's a little bit how you can see who the people are that work. About 80% of our employees are female. This is one of those industries where the vast majority of healthcare is staffed by females. And then about 18% of them are male. We're proud of our tenure. We've got an average about 8 years is our average tenure for our employees. There are some employees that are constantly turning over, some of the frontline employees like the medical assistants and front office staff. They're young, they're in school, they're changing jobs, graduating and moving on to bigger and better things. But we've also got some of those same roles that have been with us 25 years. I just signed recognition certificates today for a big batch of employees that hit 10, 15, 20, 25 years. And it's fun. I just hit my 10-year anniversary with Canyon View. My administrative team, the last one I hired was in 2016. And so we've been together as a solid administrative team for the last 8 years. In fact, turnover, so we experience about a fourth of our staff turns over each year. Benchmark, though, in our HR information systems, it gives us a benchmark and says of all the other people in the country that we have as clients that use the same NCIS code, that defines what your business is. It's a 5-digit number. The average for your industry is 43% turnover. And Canyon View, we're only at 23%. So that's for doctors' offices specifically, not just healthcare in general. So we do a good job of keeping our employee turnover low. In fact, I remember I was at a Chamber of Commerce event and Chick-fil-A was speaking. And this was a year or two ago. And the owner of the Spanish Fork Chick-fil-A said, my turnover rate is 400%. Every year, I will cycle through 4 batches of my entire workforce. He said, the only person I expect to be working for me next year that's here today is this lady standing right next to me. She's my assistant manager. But I anticipate every other employee will turn over before year's end. And so I went, holy mackerel. I thought it was frustrating that we were dealing with 20 turnover, but that's a whole different world. And as far as actual economic input to the community, $17 million of our revenue goes to employee payroll. We pay for a lot of supplies and other things as well, but just employee costs and benefits, including the physicians and all the staff, is $17 million. And the majority of that is staff, not physicians, in case any of you are thinking, well, that's just all the doctors. No. Other things that we like to do, our tagline for Canyon View Medical is caring for our community. We live in this community, we work in this community, we serve in this community in various other civic and church functions and things like that. Obviously here in the Rotary Club is one thing that I've loved doing. Some other things that we do. Each year we participate in the United Way Day of Caring. This is a picture from what we did this last year down at Santa Quinn Elementary. We painted the playground with some fun map and hopscotch and alphabet caterpillar. We've done fundraising drives for United Way, sorting food at Tabitha's Way. Here's a picture when our employees went to Tabitha's Way. As part of the Rotary Club, doing the Nebo Pantry donations, the dictionaries, and the golf tournament where we participate in that to provide money for college scholarships. We sponsor a lot of the high schools with their sports and activities. We participate in the Spanish Fork Active and Healthy Wellness Fair. When the city got a grant to try and improve the health of the city, this was put together by Intermountain Healthcare about 8 years ago. They came to us and asked if we would help chair that committee. Dr. Walton and I were on that committee for years. And the city got some funding from Intermountain Healthcare. There was 3 cities in Utah. I think it was like Hiram up in Cache Valley, West Valley City, and Spanish Fork City all got some money that the city used to try and improve things. And so the wellness fair was one of the things that the city put on and has continued doing ever since then, even though there's no more funding for it coming from outside entities. We've had a booth every year at that. And then every year, as part of Fiesta Days, we sponsor the Speedy Spaniard 10K race and mile race for kids. We pride ourselves on providing good quality to our patients. We've consistently been ranked as one of the best groups in the state for meeting measures. There are incentive programs that we have with all of the insurance companies that look at how well we're meeting what we call gaps in care. So you come to us and we say, have you had your mammogram? Have you had your colonoscopy? Have you had your cervical cancer screening? Are you up to date with your immunizations? All those types of things. We always rank very, very high in this state. There's also another thing where they look at and they say, this is what we would expect your group of patients to cost us. We know they see you primarily as the primary care provider. And based on the diagnosis codes that the physicians put in your history from everywhere that we get data from, whether it be from your group or other groups, we expect that the total cost of care for you and your for you would be, I'm just going to make a number up, $10,000, Jeff. Because you have XYZ diseases. Somebody that's healthier is maybe $5,000. Somebody who's in a complex renal failure is maybe $40,000. We expect that to be the cost. How much does it actually cost when those patients see Canyon View? And we do really well there. We are usually significantly below the benchmark on what they expect it to cost, but what it actually costs. So we do a good job of keeping patients as healthy as possible, helping them avoid the ER, inpatient stays and things like that. And we've been recognized by various groups. Health Insight is a statewide agency that rates not just rates, but helps clinics improve their quality. NCQA is National Quality Association. We are a patient-centered medical home. That's a recognition from them. We, every year, participate in the Utah Valley Best Of. There were some years where we would send out emails to all of our employees and all of our patients, vote for us, and it just was such a hassle administratively to try and solicit votes. We quit doing it a few years ago, and yet we still keep getting voted every year. So this is just natural votes, not solicited votes like so many businesses do in these type contests. You can see this is an award we got from Humana. This is one we got from Select Health in previous years where they've said, you guys did a great job taking care of our patients. And we're fortunate to have good health care in our state with a lot of good providers. I don't want to put down any other practice, but I am very proud of the work that we do